Good day, everyone, and welcome to the CBN Web Seminar, Addressing the Youth Mental Health Crisis, the Role for Employers. I'm Lynn Gresham with EBN, and I'll be moderating today's discussion. It's clear that both parents and young people require additional support to navigate the challenges of our rapidly evolving world. Over the next hour, we will learn more about the problem at hand and explore effective strategies and solutions. We're going to start today with an introduction and then move on to an update on youth mental health, the impact on working parents, followed by strategies for employers, the benefits of solutions for adolescents, and then how you can help make an impact. We have a distinguished panel of experts with us today who will share their insights and expertise, and I'd like to introduce them to you now. Dr. Tariq Chaudry is a practicing hospital pediatrician. Marti Bledsoe is a working parenthood expert. We also have Dr. Lacey Rosenbaum, a youth and workplace well-being expert, and Cate Hanrahan, an education consultant. We'll also be hearing from Bikram Roy, the founder of Bonfire Digital Wellness. Our speakers are going to answer your questions at the end of the presentation, but feel free to post your questions as they come to mind, and we'll get to as many as we have time for. First, we're going to hear from Tariq, who will share more about the current state of youth mental health and the various challenges teens and their families are facing today. Tariq, the floor is yours.
Thank you. Thank you so much for the introduction, and I'm happy to be here speaking about pediatric mental health. So as we said at the beginning, I'm a practicing pediatrician. I've been a pediatric hospitalist for a little over 20 years. I'm currently a physician leader, the chief quality officer at Kentucky Children's Hospital. Also involved in digital health and involved in entrepreneurial pursuits, and a father of two wonderful little daughters. Throughout my career, I've really been an advocate for working on things like pediatric asthma, pediatric sepsis, oncology, transport medicine. But of late, I've become very much more dedicated to the problem of pediatric and adolescent mental health. Part of that is because we're seeing a huge increase in the impact of pediatric mental health issues. And primarily as a hospital physician, we're seeing the impacts of kids in crisis. We see kids when they come to the ER, when they're getting hospitalized, when they're having issues with suicidal ideation and even suicide attempts, sometimes successful. And we really see them when things have really got to their worst. And it's one thing as a physician, as a quality and safety leader, I realized over time that it's really hard to intervene at that point. You know, when we're limited to capacity as we were over the last couple of years, we don't have enough of a pediatric mental health infrastructure to be able to support all these issues. We really have to think differently in order to really make a dent and really impact children's lives in a better way. And for me, that's involved changing the mindset and thinking more about getting ahead of the problem and thinking about a proactive population health strategy. And not only do I see that as a physician leader working in quality and safety and getting to look at capacity and cost and impact and how hard it is to intervene, how long it takes the treatment to reverse some of the thinking and how much families need to be involved when someone is deeply depressed or deeply anxious or has a severe eating disorder. It takes a lot of years to reverse that. And so I think the key for us, as we think about, reversing this trend in this country is to get proactive and preventative. And I've even been further, heartened to follow this mission because I have two daughters that have had their own issues with mental health. And I think that they're, in forcing myself to look at those things as a parent, not only as a pediatrician, I've seen that early intervention and prevention and opening up a dialogue and talking about these things can be really, really effective for your own children. And I think about the worst case scenarios, your kids ending up in the hospital or the ER. And I think we have to work more and help parents and help families think about preventative strategies more because it's much easier to deal with those things early on than later. Some of the statistics that have been really troubling to look at, I'm sure that everyone is aware of the data that's been out there, and having our Surgeon General talking about a pediatric mental health crisis, the White House. But some simple stats to remember, some of the ones you're seeing here: 50% of all lifetime mental illnesses begin by the age of 14. It's really, really important to think about. I'll throw in some other statistics, not to overwhelm you too much, but one of the ones I like to really harp on is it takes an average of 11 years for kids to get into effective treatment after an initial diagnosis is made. Another one that you see on the screen here is only about 20% of adolescents experiencing mental health disorders are actually getting treatment at this time. There's been large increases since 2016, about 150% increase in ER visits for pediatric mental health issues. Hospitalizations over the last, let's say, about 13 years. If you look at just 2009 to 2019, before the COVID pandemic is coming in, we had about a 25% increase in pediatric hospitalizations for mental health. So the impacts have been huge. One thing that's very important to know is that this wasn't caused by COVID. The problem has been on a kind of a linear pathway increasing. And so there's well-established data on increasing ER visits and hospitalizations, increasing prevalence of disease up to 2019, 2020. And then during the COVID pandemic, with all these other factors, you had another spike that happened on top of it. It was kind of the straw that broke the camel's back. But the problem was getting worse, and we were struggling to deal with it even before COVID started. So hopefully that some of that increases a little bit, but you still have the pre-existing issues that are back pre-pandemic that are serious and causing a big impact. I think some of the things what we want to do is try to focus on, like, what do we do? What can we do that's better? What's causing some of these things? And so mental health. There's social determinants of health. There's basically genetic factors involved in mental health issues. There's a lot of factors that are involved, but some of them are harder for us to act on. Some of the things that it may be easier for us to look at when we're thinking about prevention, when we're thinking about ourselves as parents and what we do for our own kids, or what kind of tactics we can build up for kids in our community. One of the biggest issues is lack of access to support. And as we work through solving this crisis, we've done a great job of doing things like leveraging, virtual care, telehealth, asynchronous solutions, or different types of websites and digital tools. For the area of mental health, this is can be a pretty effective tool. But we have to remember that there's a limited number of therapists out there. There's a limited number of psychologists. There's a limited number of personnel to do all these things. So we can't simply just say, we're just going to go to more telehealth, and then we're just going to refer, and magically that's going to happen. We have to kind of take an all of the above approach and think about prevention as well. And some of these things involve changing some of the modifiable factors can be changing the way we look at, the way we're living our lives, And if we think about the pre-pandemic phase, some of these things have been getting worse over time. Can we think about like sedentary lifestyles, getting appropriate sleep for children? That can cause irritability and cause symptoms. Digital overload. There's been a lot of talk about social media and the negative impacts of it. There can be positive effects of social media on kids and their development, but largely they can be more negative. And then the increasing stress levels. And not having effective ways to manage it or acknowledge it and talk about it are really, really important. And certainly during the pandemic, everyone's stress level as a nation, as a world, as a planet, increased on top of what was already there. And that's really what kind of pushed a lot of people over the edge. And so I think by focusing on working on some of these preventable, modifiable factors, those are things we can do in addition to the traditional mental health things we're doing, like getting involved, getting referrals, destigmatizing mental health, getting referrals to therapists, talking about our issues, when appropriate, using medication or other types of therapies, family-based therapies, things like that. Some things for those of you out there that are parents yourselves, that I want to mention is like Boston Children's put out this great tip sheet looking at from their digital wellness lab, looking at some things that you can do, especially when you're managing social media, digital health, or digital screen time. Things like doing co-playing and co-viewing with your kids. Get involved when they're doing stuff. They are gaming a lot. Get involved with it. Look at what they're doing, watching what they're doing. You can not only create a bonding experience, but you can also make sure that they're making good decisions. And you can see if there's content that's being picked up. Try to model your own good digital habits. I work on that every day. I've had my kids tell me to put down the phone, and those are great cues for us, So we're engaging with each other as families, and being able to see what's happening and start talking to each other more. Doing things that creative. One of my kids, well, I think she's going to be a movie maker, a journalist. She's doing stop motion photography as an app. That's a great example of screen time. I think that allows her to build in her creative outputs. And then the most important thing is getting breaks, getting away. We kick our kids outside to go play. We get them away from the screen when we can. And certainly we're not perfect. I think my kids get too much screen time, but these are the things that are really, really important to think about. And so these things are just a small piece, along with building out a better infrastructure to really move toward a more proactive approach. We have to identify kids earlier. We have to talk about it. We have to start using the language of, talking about depression, anxiety, eating disorders. That's a language we use in my household. One of my daughters has an anxiety corner, and she goes to it and she practices biofeedback. I give her my Apple Watch sometimes when she needs to kind of calm herself down. My other daughter knows when she's getting anxious. Some of these things are really, really important to do. And if we equip kids with those tools early on so that they can be resilient as well, they're going to be able to lead healthier lifestyles. And I think that's some of the most important things that we can do that are modifiable, that parents out there can do, besides, having the health system be involved. So I'll kind of stop right there. And thank you so much for your time and being able to chat.
Thank you, Tariq. This was very eye-opening, and we commend your efforts to try to reverse these concerning trends. Next, we're going to hear from Marti Bledsoe, who was part of a groundbreaking study on the impact of youth mental health and working parents. Thanks for being here.
Hi, Lynn. Thank you for the intro, and thanks everybody for allowing me to share a little bit right now. I loved the way Dr. Chaudry wrapped all of that up with some stories at the end there about his own family, because who among us can't relate to the notion that we're doing the best we can at home, and sometimes it's not 100% perfect. 7 years ago, I pivoted my entire career to be all about supporting parents and caregivers in the workplace via employer programming. So we work with employers to create strategies around caregiver inclusion, and then we provide courses and manager training to make sure that gets carried out inside an organization. And one of the biggest programs that we've had the privilege of working on has been with On Our Sleeves, the Movement for Children's Mental Health. And together we worked through two really important studies with working parents to really understand how much does a child's mental health impact that parent's ability to show up at work and give their very best. And it's probably no surprise that there is a connection between how well the family, the child is getting along and functioning, and how well they're managing stress, to how easy it is for mom or dad or even a grandparent caregiver to set some of those concerns aside, go to work, be present, and then, return home to that caregiving role. So the two studies that we conducted in total talked to more than 7,500 working parents across the United States. And we really dug into some of the connections that parents were feeling, one of which is most parents did not grow up in a home where mental health was discussed. So there were no anxiety corners in many of our parents' and grandparents' homes when they were being raised. And not only were there not skills being built, but there wasn't even vocabulary. So Dr. Chaudry's point about talking openly about anxiety or eating disorders, this is a whole new concept to a whole new generation of parents. And they're trying to parent in a way they really don't have a blueprint for. So they're turning to all different kinds of experts, therapists, coaches, apps, books, influencers, trying to understand how they can really build these skills in their kids in a way that they didn't necessarily have patterned for them. And if you've ever had a concern about mental health, either for an adult or a child, you probably know it's a different treatment plan than it would be for an ear infection or a broken bone, because it's sustained intervention over time. So whether it's medication that needs renewed, or therapy appointments that need scheduled and kept up with, or even telehealth where you need to repeat that interaction, you understand that this is something that takes more time than one or two appointments. And today's workplaces really are not set up for sustained interruptions like that. We have not necessarily built that into our staffing, our management training, our productivity metrics, and making sure we understand how teams perform, because we've not faced something to this degree in the past where it's interrupting work over and over and over again. But we are starting to see it now. And we know that the younger employees, the younger parents who are just now starting families or even thinking of starting families are coming into the workplace with a much higher expectation of how an employer will support their own mental health or their child's mental health. So we see a rising expectation among younger workers, those who are starting to graduate or starting to apply for roles or get into their first manager position. And they're saying that if there's no child mental health support in a particular job or company or organization, 37% of millennial parents said they wouldn't consider working there. So I'm just going to pause there for a second. So that's almost 40% of an entire generation of upcoming workers who say, if there's no child mental health benefit or support of some kind in this organization, I'm not going to go work there. So you really start to see that this new way of parenting is becoming something that parents need support from everyone around them in order to pull it off. Because again, it's not something that they naturally understand how to do. We also heard that this will heavily impact a parent's job decisions. So we actually asked how many parents have quit or pulled back on their role in the past 2 years for reasons related to their child mental health. And among all parents, it was 32%. So a third of the parents we talked to said they'd made some sort of adjustment in the past 2 years. It was 2x for African-American parents. So closer to 2/3. And among the parents who already qualified as what we called mental health disrupted, so they already had a diagnosis for their child or they had an extremely high level of concern, it was about half. And those are really staggering statistics when you line them up against the fact that parents don't really want to tell HR or their manager or their team leader that the reason they're missing work, the reason they're distracted has to do with a mental health concern for their child. So we think there's a lot of growth happening in families and homes where maybe vocabulary is being used and anxiety corners are available. But to turn around and share that at work is still really stigmatized, especially in certain organizations that have a very hierarchical type culture. And so what we deem most interesting about that is that means people are quitting without the manager or boss or team leader or even HR understanding the issue and being allowed to step in and say, how can we better support this parent? If they're very concerned, they are making these decisions and they don't want to talk about it, then you're running into a bigger risk of attrition. And so we think that child mental health has been a huge contributor to what the business, economists and writers love to call the Great Resignation. And it's actually as much influenced by what's been happening at home as it has been influenced by what's been happening in these workplaces. And we are really hoping that that does not get overlooked any longer as we try to support parents. We also ask these parents, would you be interested in a wellness offering from your company that supports your mental health, your physical health, or your child's mental health? And any of you who have kids know we automatically pick what's great for our kid first, right? Well, it was a really overwhelming majority. 88% said they were interested in something like that because they're really struggling to bring all of this together and keep everything moving forward. And even when they're at work, I will highlight some of what's up here. 30 to 50% of their mind share is actually kind of running in the background about what's going on with their child. Are they adjusting? Okay. How's the school year going? Or what am I going to do for summer? And it's not just what am I going to do for summer in terms of activities and camps and logistics. It's also if the child has too much screen time, to go back to Dr. Chaudry's example, if the child doesn't have enough quality peer interactions and creative outlets, then perhaps they start to struggle where they become more and more stressed. And as you understand from everything the doctor said, the more stressed they become, the less resiliency skills they already have. That's when you start to get into some of those escalating concerns. And so parents who are sitting at work processing all of that while they're trying to be in a meeting, while they're trying to conduct a performance review, while they're trying to, get a deliverable out on deadline, or even work a hands-on shift, that can be very, very difficult. We really want to make sure that employers understand there is a way for them to step in, not in a stigmatized way, in an open and welcoming way. And so we think it starts with talking openly about mental health in the workplace, using the correct terminology, making sure that things are not brushed under the rug, and you aren't necessarily taking a sick day, you're taking a mental health day. If and when that's the truth, it helps when leadership can express themselves in those capacities. The parents' challenges are everything from that very loaded phrase of work-life balance. We hear a lot of people talk about that, and we've heard other words for it: work-life integration, work-life, coexistence. It's really hard to get to that state of balance when the concern about your child is of such a high and consequential nature. The mental health challenges of children affect parents in their own mental health and in their own ability to stay resilient to stress over time. You can imagine how a parent who's worrying 30 to 50% of their time at work is probably also laying awake at night trying to figure out, how do we get treatment? Is that the right diagnosis? How do we, keep this up in terms of sustaining this intervention? And then staying connected. Organizations that consistently win the Great Place to Work award for parents are those that have family-focused employee resource groups, other gatherings of parents in an organization that help those families, leaders, stay connected. And then as your children age, they say it's bigger kids, bigger problems. And as the mom of a 13 and 9-year-old, I can actually attest that is very true. Because now it's not just, how do I introduce a new food? It's how do I introduce and protect against, the dangers of a new social media app potentially? Or how do I help direct someone in my family? It's a lot of LGBTQ questioning. And how do I support that in my kids and make sure that they are experiencing everything that they need from support and can make those good choices? And as they become older and into those teen years, it becomes even more of a pressing issue on the mind of parents. So I'm looking forward to the rest of the speakers, and also I can answer any deeper questions about this during the Q&A.
Thanks so much, Marty. That was wonderful information. Now we'll hear from Dr. Lacey Rosenbaum, who will share some strategies and best practices for support programs. Unfortunately, she couldn't be here live, so we're going to show a recorded conversation she had with Bikram last week.
So much. I'm so excited to be a part of this conversation. Hated that I couldn't be with you all in person. We are on our family vacation, but didn't want to miss an opportunity to just contribute, as this is really at the intersection of everything that my career has been about. Just by training, have clinical research background related to young people and mental health. Just really passionate about resilience and resilience promotion. And I've led several mental health initiatives for the American Psychological Association, Mental Health First Aid USA, partnered with Lady Gaga's Born This Way Foundation. And now in my consulting business, I work closely with organizations, workplaces on all things related to mental health through training, education, promotion of high quality mental health treatment and support. So it's really kind of at the core of everything that I've been doing. I think it's just essential that HR professionals and leaders are aware of fostering this culture of mental health. I think we all know and we recognize that so many of us, 1 in 4, in fact, will experience a mental health challenge, and even more of us are going to be impacted by this at some point in our lives, whether colleague, loved one, friend, child. And we know that a lot of people aren't talking about mental health at work, about mental health challenges, and a lot of that is because of the stigma. That stigma exists that you're not able to really bring your full self to work. whether that's as a caregiver, or, kind of all of your identities. And so it's thankfully changing. And I'm seeing this a lot in the work that I'm doing, which is really, really impactful. Seeing so much more focus on the well-being culture, and yet, I think there's a lot of work to be done in this space, especially when we think about supporting caregivers and that vital role that they have. Because as we know, when people log out of Zoom, when they leave the office for the day, they still have really important responsibilities, especially related to young people and teens.
It seems that there's a big gap when it comes to, support for parents of teenagers. But, going back to even kind of what Marti was talking about, like, what have you seen in terms of, well-being of working parents, and, where, how does the having kids play into that?
Yeah, no, I think that's such a great question. And, as a working parent, I definitely, as you're noting, experienced, some great support, as I, had my own children. And yet, we see in so many of the companies I work with currently, kind of this big gap, right? Once people have, had their children, we kind of forget about those kids and about all of their needs. And so this is really like front and center, and it's so important that we're talking about it today, because every workplace is essentially impacted by the mental health crisis right now. And as Marti's stats are sharing, right? These are employees that are coming into the workplace every day, dealing with that stress, the anxiety of supporting a young person, promoting their mental health, making sure that they have what they need to be resilient. And so this situation can't be resolved, right, by just one stakeholder. You can't expect that schools or parents or even mental health clinicians can be doing this alone. So employers, HR leaders, they're really in a great position to lead, to be able to impact youth mental health in a positive way. And I think it's not just the right thing to do. I mean, it makes good business sense, absolutely, because it really helps, first of all, the young people themselves benefiting from these resources, but then on the other end with the employees, I mean, we can imagine, and we'll see from data, reduced employee burnout, really being able to save on those costly turnover expenses, and improving employee productivity, loyalty, innovation, morale. I mean, I think it's a win-win when we're investing not only in parents, but also in their whole families. And that's going to pay off. I think employers are going to reap those benefits now and in the future.
Okay, great. Yeah, so, what are some examples of, obviously there are, different spectrums of on the youth mental health, kind of optimizing it as well as in the crisis. But where are the different types of benefits and resources that you're seeing in the industry now that employers should take a look at?
Yeah. I think there's several good examples of preventative benefits and resources that I would recommend everyone consider. I think mental health screening is vital. Doing this regularly for adolescents, that can really help identify those issues early on. And the earlier, the better. The earlier we intervene, the more likely that young person is going to be able to get that help and recover. And employers can do this in a variety of ways. You can partner with healthcare providers, organizations to facilitate those screenings, provide appropriate interventions. So I think that is a great idea. Definitely encourage people to explore. I think another idea is just related to digital wellness programs. We've all heard about how important this is, promoting healthy digital habits. And that might look like an educational campaign, a workshop for parents, can be really impactful. All could use some breaks from our screen time. I am guilty of this myself, thinking about how we establish those screen time limits and just fostering positive online experiences for employee and then extending those education opportunities for families. think another consideration is just the support networks. We know from research how important that sense of connectedness is. So the more that employers can be offering platforms for parents and adolescents to connect, share experiences, having that human to human connection is vital, and just providing some of those support systems. Employee resource groups can be a really great way to do this. And I always encourage employees to think about those not as just kind of like a social club, but really as a vital tool for your organization. And even a pulse check, giving some of the employee resource group leaders access to your top leaders to really be able to share what's going on and some of the resources that could be beneficial for parents in that group. And then I think the last idea would just be considering collaborating with mental health organizations. There's some great organizations out there doing some awesome work. So being able to partner with them, those wellness organizations, whether that's offering counseling, therapy, coaching, even support groups for parents, adolescents, and to be able to do it in a way that's, accessible and relatable to their lives, can go, just really be a vital option. So I think those are my four.
Okay, great. Well, there's a lot of good stuff that employers can offer. So, in terms of obviously ROI is a big talking, phrase that we use. It's certainly from employers. But how would they, go about, kind of implementing it, and then kind of measuring the impact and the effectiveness, and evaluation methods to see if this is worth it, has been a good investment or not.
Yes, this is always kind of like top of mind when I'm working with any company, because we all want to know that what we're going to do works, and we want to know that our money was wisely invested. And especially, I think that's true in this economy. So evaluating prevention programs can be tough. As a researcher, I'll be the first to admit that it's hard to know, because when they're working effectively, like, we're not going to see maybe that child that was going to develop an anxiety disorder because perhaps they've learned some effective coping strategies, or we might not know that child that was contemplating suicide because their parent was equipped to intervene early and have a supportive conversation. So we don't see those same outcomes. And we might not see some of those changes right away. This can take some time. So just encourage people to be patient, but start thinking about how you're going to adapt your measurements accordingly. So for anyone that's just starting out, I often just recommend kind of a general needs assessment, kind of getting a good sense of your baseline to determine what prevention benefits and resources would parents and caregivers really appreciate. Asking employees goes a long way. It shows you care, it shows you're listening, and then you can respond accordingly. Definitely always recommend finding ways to track utilization of those services. And before doing that, I always tell people to take 2 steps back. Make sure you have a really strategic plan for letting employees know what the benefits are. I have worked with companies and they have this amazing portfolio, a suite of prevention, wellness resources. No one's using them and no one knows about it because they were talked about that very first day on employee orientation, and they've never been discussed again. So make sure you're actively maybe working with your comms marketing team to get that information out and make sure it's readily accessible. I also really advise, thinking about those satisfaction surveys. When you're bringing on a new vendor, often they might have something that you can utilize, or they might be collecting that data. Make sure you ask them for that, so you can see, how that's working, and that can really help inform, whether you're going to continue working and engaging in those services. And then definitely think about any surveys you're already doing. So many companies out there are doing employee engagement surveys. Add some questions about wellness and prevention, benefits, resources. Ask people if they're using them, what else they might like to see, and use that to kind of guide your path forward.
Okay, great. Well, thank you for your time. Is there any last words, or are you optimistic about the future of well-being in the workplace, or what is it that keeps you up at night with this job?
Yeah, no, I am optimistic, and I love that you asked it in that way. I mean, I'm seeing just incredible movement, even from, a couple years ago, with so many more employers who are really aware that employees want this. They want wellness resources. They want to be able to bring their full selves to work. They want to be able to talk about being a parent and all of the roles that they play. But they need some help and they need some support to do that. And so, I think for everyone that's here in this conversation right now, it's an awareness that this is important. And so I'm just, hoping that we continue to see, the funding and the investment and some of that to be able to then measure the results, because I feel certain that we're going to see them, and we're going to see some major impact on our young people and on the parents and caregivers that are supporting them. So yeah, thank you so much for having me. It's been great.
Thank you, Beek. That was an illuminating conversation. Now I'd like to hand the floor to Cate Hanrahan, who will discuss some of the benefits of early intervention in supporting adolescents. Cate?
Thank you, Lynn. And I'm just so happy to be here to be part of this very critical conversation. And thank you to the presenters who have already shared their information. I'm somebody who has worked in schools, and so supporting kids and families in a school setting, I too, unfortunately, have seen a lot of the crises that Dr. Chaudry has discussed. Being in a school setting, we are sometimes the first to notice a behavioral or a learning issue because it hasn't really presented itself until the school age. We know that intervening as early as possible can make all the difference when it comes to a child's well-being. We also know that in order to provide the best support, we must take a whole child approach. And in a school setting, sometimes that can be really challenging. The whole child approach is pretty much just that. In order for a child to experience optimal well-being, they have to feel healthy in every facet of their life. And that means socially, emotionally, physically, and now, as we've already discussed, digitally. It's been my experience when kids have access to and are supported in all of these areas, both in and out of school, we can see improved social, emotional, and physical health. We can see strengthened connections and in relationships, and we start to see kids can develop a growth mindset. Lacey and Marti gave solid examples of some preventative supports like mental health screenings and coaching and mindfulness apps. And I really think those are great resources for families. By being proactive, we support adolescents in making healthy decisions that will reinforce a positive self-esteem and a growth mindset, which will impact their wellness for future. As a parent myself, I also took a step back from work, and I definitely think that, as a parent and an educator, I believe that families also really benefit when we proactively support a whole child approach. It can lead to wellness for the whole family, which I think is obviously really important. We did talk about this concept of work-life balance. And I think when kids are supported, then families are supported, and they can think about the balance and just healthy relationships and then being able to stay connected to their kids. So thanks for your time.
Thank you very much. We appreciate all those important perspectives. Now I'm going to hand the floor over to Lilla Momtahen of Bonfire.
Hi there, I almost didn't unmute myself. Hi, I'm Lilla Momtahen. I'm the Director of Member Success here at Bonfire Digital Wellness, and I'm also a family advocate, which I think is the best job ever because I'm the lucky one who gets to see the before and after. So when most parents come in at first, I get to speak with them and hear about what's going on in their lives, and then I get to see the progression and the successes at the end. And I wanted to share just a couple of little testimonials and things that I see the most with parents is, yes, like the first meeting, I see the stress, I see all of that. And a lot of it's working moms, working dads, they're taking that little half an hour out of their day to come and speak to me. And I see their stress. And then the thing that they say after months, couple months, few months is like, wow, this has been so invaluable for me because it's like, it's amazing to know that you have a trusted adult, another trusted adult in your corner for your kid to talk to. And one of the parents that I spoke to recently, and we did a testimonial video, she was like, the stress reduction, the reassurance of having that is just huge for me. And she said it was very impactful, like on her work. She's extremely successful parent, working mom, single mom. So we did pair her with a male coach, and she said that was huge for her. And she came in with worried about her son with anxiety. So not only, this is the part that she was like, not only did his anxiety go away because he got taught from the coach like valuable tools, but she's like, he was actually making goals for himself outside of that. And so some of the goals were like getting on a basketball team, spending more time outdoors, lessening his technology use, all those things that she said that she was just like, it was like a bonus. Not only did the anxiety go away, but all this happened as well. Another parent that I spoke to basically said that when she was looking for help, she was looking like maybe because she thought her daughter didn't really need therapy. And so she was like, okay, so she doesn't really need therapy. But she looked into some life coaching. She didn't really see anything out there that was for kids and teens and tweens. And so she looked, then she went back to looking for therapy again. And she was like, oh my gosh, the therapy is just skyrocketed. It's like 500 plus an hour. I can't find the right resources. Either people are too like busy, they're like out like a month. And so her school actually offered Bonfire to her, and she was just so grateful for that. And she was like, I am just beyond grateful. And so they've been with us for like about 4 or 5 months now, and she's like, I want this like all the time. So as far as what Lacey was saying in the ROI, I'm the one who gets to see it. So I get to see, even in the short time, in like 3 months, I get to see the stress leave parents' faces. And so I'm, like I said earlier, I'm lucky to have this position and working for Bonfire, and I get to see so much of the changes. And if you have any questions, please reach out to me. And I want to introduce you now to our founder, Bikram.
Hello. Thanks, Lilla. Thanks, for all the speakers today that, really shed some, concerning light, but also optimism that, there's things that we can do from, all across the board in our society, but also from an employer's perspective. My wife works for PNC Bank, and we've got younger kids, and they've got tons of great benefits that most of them we haven't even used yet. So I know you guys do a really great job of doing great things for your employees, and well-being and crisis and everything in between. So thanks for being here and all that you do for your companies. Obviously, thanks for all of our speakers. We, like Lilla said, we see that this stuff works. It's not really rocket science that you give kids attention, or any of us attention. We're gonna start feeling more confident about each other. We're gonna start doing better habits. That it's easy these days to get caught up with all the screens and distractions and anxiety. And then if you're challenging a career, a lot of times the parents may not have as much time to really be in their lives as much as some of these kids need, or all of us need. So thanks again for being here and staying through.
We would like to jump on the audience questions now. So I want to start with this one. What is the difference between therapy and coaching? Tariq, would you like to start this?
Yeah, I can comment to that from a kind of a medical perspective, and then any of my colleagues can chime in as well. So, I mean, I think so coaching and therapy both have similar goals, and that ultimately they're trying to modify behaviors and change thinking. There's a little bit of a difference in the techniques that are used. So you might use motivational interviewing, positive psychology, techniques like that a little bit more on the coaching side. It's less focused on clinical diagnoses, such in the case of mental health, like less focused on things in the DSM-4 manual, or like specific diagnostic criteria for anxiety and depression, kind of looking more globally. Therapy, so basically psychotherapy, uses some of the similar tactics, but then they have different subtypes and different techniques within psychotherapy itself, and it'll get a little bit more intense on focusing on a specific disease process and use some different tactics. So I'd say coaching, for example, is something you might use for like a population that's generally well, or maybe there's some just a general low level mild conditions, or if you're screening a group, if like the mild group, you might say, okay, we'll do some coaching with this group. But for kids that maybe screen, like for a mental health condition, for example, and may have like moderate to severe symptoms, you might want to be referring to using basically therapeutic interventions like cognitive behavioral therapy, family therapy, dialectical behavior therapy. And those might be with a psychologist, licensed and managing family therapist, or other like licensed clinical mental health professional.
Great. Cate, would you like to add on to that?
Sure. I totally agree with everything that Tariq said. I think from a coaching perspective, I would just say that obviously they're both a neutral and non-judgmental supportive space for kids to be seen and heard. Coaching obviously doesn't treat mental health conditions, and so we don't want to use it as in place of any type of therapy. And as Tariq already said, if someone is dealing with depression and anxiety, coaching is certainly like not the first step. It's not a replacement for therapy. I would say that coaching is more of a proactive approach. We emphasize on the relationship, not on the action, and just accountability, helping them set goals and follow through. And I definitely think coaching can be a good supplement also to therapy. So like maybe doing it even in conjunction and collaborations.
Very interesting. And how long does it take to start seeing changes with coaching?
Do you want me to take that? I would say in our experience, I would say at least 3 months, you have to develop relationship first, and that can take time. I think that's most important, is just developing the positive relationship. And then you can kind of get to like, what are some of the goals that we want to set and some of the areas that we want to focus on. So I'd say at least 3 months.
Yeah, Cate, I think to me that sounds right, like at a bare minimum. So it is more time intensive, and then you add like therapy would probably take even longer because there's more deep-seated habits to change. But really you're changing behaviors and you're building new habits. And, I think you're like a minimum, you're looking at like for some behaviors, like 6 weeks, but something like this, I think 3 months is a good number, a good estimate.
And how exactly does the Bonfire program work?
I guess is that Cate again, or is that Lilla?
Let's try Lilla. Take it.
Sure. Hi. So how our program works is basically we do a discovery call first, and that discovery call is with one of our family advocates, so me or one of our team members. And then we kind of discover see what's going on with that kid, see what they need. During that call, I'm really listening in. Like I said, this son in the last time needed kind of a male role model. So male role model, maybe, Spanish speaking, or maybe, African American or Latin. It doesn't matter, but I'm listening as the person at who's going to be the best fit for this kid. If they're only like very sports oriented, they're struggling with their relationships, we put them with a coach that's very much into sports and can connect in that way. And so it's once a week for 30 minutes. They meet with their coach. The first session is with mom or dad and the kid. And so they can introduce themselves to the coach for 30 minutes. And then they set up weekly meetings, and it goes from there, and it's individualized. So if a kid, but most sessions, the coach will check in on all the things that we feel is really important. Two is the sleeping, eating behaviors, physical activity, their tech use, and their overall well-being. And then after there, it's individualized. So Cate, do you want to add something? I think I hit all those things.
Great.
I think that's great.
Okay.
This question is one I think everyone can weigh in on. What do you think the lowest hanging fruit is regarding youth mental health? Marti, would you like to kick that one off?
Gosh, there are so many different things running through my head at the same time, but I think one of the lowest hanging fruit pieces is attacking the stigma in terms of the adults in all walks of life, from my teacher to my school counselor to my librarian to my doctor, all talking openly and with correct terminology about what mental health even means. I think that if children got more exposure to that over time and it became something really natural around them, it would potentially help us get those early interventions made much easier because children might understand what to ask for or what to appropriately call something. So to me, that's the number one.
Thank you. Tariq?
Yeah, I think a lot of that definitely what Marty's saying definitely resonates. And I would say, again, citing the example of my own daughter, who had been, probably spent about 6 months in therapy. One of her summer goals she had written on something that she brought home from school was like she's going to work on dealing with her anxiety, right? And she wrote this in her over the summer goals, and I'm like, wow, that's so great that she realized that she's done an amazing job, like dealing with some of these things over time. And, I realized even in the school setting, and even like in our home, like that language is just out there. It's normalized, right? And so I think that's really important. I do think, for the question of low hanging fruit, it was some of the things I initially mentioned in the first session when I was on, of like thinking about how to manage some habits at home. I think those are easily modifiable. I think there's higher fruit up there, and I'm involved with other digital health initiatives of like, screening in school, as Dr. Rosenbaum started with. I think screening is important because there are occult things that are hard to recognize, but that's not a low hanging fruit. But I think looking at modifiable behaviors and things that you can do at home, like those kind of tips that I mentioned from the Boston Children's Wellness Lab, of like kind of getting involved with your kids, getting engaged, knowing what they're doing, managing their screen time, managing yourself, trying to have those different conversations. And if you don't know how to do that, that's hard to do. My wife and I both have, clinical training in pediatrics, and we struggle. Find resources that can help. So I think those modifiable behaviors are really the lowest hanging fruit in all this. But there's a myriad of solutions that we need to build into our healthcare system structurally and at higher levels to really identify and prevent a lot of disease.
Cate, your thoughts?
Sure, I absolutely agree with everything that's been said. I definitely think stigma is a huge issue, and just coming from the education world, awareness and really prioritizing social emotional learning for all. I think that is also something we talked about for so long, even before COVID, and now it's just this thing. And if adults in the building don't understand social emotional learning, those skills aren't transferable to our students and to our kids. And so I think that's a really big deal, that as schools, as educators, we really have to also lean into this conversation about social emotional learning.
Thank you. I want to jump on to another question. Have you utilized EAPs in the workplace to assist this challenge? Marti, can you take that?
I'd love to chime in. Yeah, in our current benefits landscape, the term EAP is often sort of the answer to mental health. Do you have mental health support? Oh, yes, we have an EAP, an employee assistance program. In reality, those programs do a lot of other things beyond just providing mental health sessions or benefits. Over the course of the lockdown and the pandemic, some companies extended the number of visits that they allowed people to utilize an EAP for some mental health support. Usually that would be with a social worker or master's level counselor. And some programs, vary. Can you use it for dependents? Almost always. Can you use it for every time there's a new issue in that person's life? Most of the time, that's how it is set up. However, the utilization rate on EAPs is pretty low across the board. Industry-wide, it hovers around 3 to 5%. And so what we do see now is some companies taking a look at those dollars and reallocating them over to different benefits that more tailor, as Dr. Rosenbaum said, to what employees want. Hopefully you're hearing back from them. And if they're saying it would be great to have a digital asset that I could deploy in my family, or a resource that I could learn from, or if they're saying I actually need more visits, then maybe it's beyond an EAP and it becomes a part of the medical plan. And I think it's critical that the employer take the pulse of the employees and understand, is that EAP benefit doing all that it could? And if it's not, how could we reallocate those dollars into some of the new up and coming types of benefits that are available?
Thank you, Marti. Well, unfortunately, we are out of time. If we didn't get to your question, Bonfire Digital Wellness will follow up with you offline. Thank you so much for joining us today for the webcast. And I'd especially like to thank our speakers for taking the time to be here, and our appreciation to Bonfire DW for sponsoring this event. If you missed any part of the presentation, you can hear a recorded version within 48 hours on the EBN website, and we'll send you an email with a link to the recording. Thanks again for joining us, and have a great rest of your day.
Thank you.